Go ahead. Okay, great. Thanks so much for being here today. So I'm going to say a couple things, then pass it to Commissioner Trevelyan, Sheriff Hernandez, County Attorney Delia Garza, Judge Needles, and then Tara Tucker, and then take questions at the end. So good afternoon. I'm Travis County Judge Andy Brown. I want to thank our law enforcement partners, the Forensic Mental Health Steering Committee members, the UT Austin Dell Medical School team, and the experts who helped us get to this point. It's a very long list, and so I'm not going to be able to name them all, but there have been a whole lot of people who have been looking at this issue. Today's a very exciting day. The Commissioner's Court and I voted to direct county staff to begin drafting plans for a jail diversion center in Travis County and to come back to us with a proposal. The result is the culmination of months of work with the UT Dell Medical School and dozens of community leaders and partners to address the growing mental health crisis in our community. To understand the scale of the problem, we heard from people with lived experiences, mental and legal health experts, judicial leaders, law enforcement, and community advocates. The resulting Travis County Forensic Mental Health Project final report recommended a mental health diversion center, among other priorities related to housing, peer support programs, updates to counsel at first appearance, and data sharing. Today's vote is just the beginning of a monumental task, but it also represents a significant investment in our future. County staff will start working on a budget, draft plans, and investigate ways to proceed forward. Once done, this facility will reduce the number of people entering the jail with mental health needs by offering the diversion center option and significantly reducing the number of people re-entering jail. Just one day in jail can derail jobs, families, and opportunities. We can make our community safer and more stable when we help someone avoid the consequences of incarceration and instead connect them to needed services. Since the pandemic, things have gotten worse in Travis County, as they have everywhere relating to mental health care. In the jail pre-pandemic, we had something like 21% of the population in there, by the sheriff's measure, had a mental health issue. Today, that has doubled. It's the same measure that we've been using before and after. That shows that the problem is getting worse here in Travis County. In contrast, places like Nashville that opened up a mental health diversion center around 2 years ago, their jail population has actually been going down, and they have noticed a reduction in recidivism in the people who go through their mental health diversion center of 70%. The jail is today the county's largest mental health facility, but it's not a mental health facility, and jailers have tasks that they are supposed to do, and adding this additional burden onto the sheriff and her staff is not a good idea. We need to do better, and today the Commissioner's Court affirmed our commitment to building a more equitable future where we provide mental health resources to the community. Today we chose compassion over conviction and mental health over mental anguish. This decision is a long time coming. Since last year, a coalition of local leaders, advocates, and county and city partners toured and learned more about diversion centers across the country to explore how effective they could be in our community. We are still going to visit Tucson, Miami, and other possible locations in the coming weeks, and I know a lot of the people standing here behind me are going to do the same. So Dell Medical School did an analysis of who it is that's going in and out of the jail and not receiving care. So they looked at booking data from 2018 to 2022 here in Travis County, and they identified 106 people in Travis County with a mental health designation, each with 3 to 99 arrests cycling through the jail. Most of these arrests are for misdemeanors, and many people could have received help if preventative measures existed. We recognize that there's not a one-size-fits-all mental health diversion facility out there, and that we need to craft something that is perfect for Travis County. Ultimately, working to remedy this problem makes Travis County safer and improves the overall health of our community. In closing, this first phase is a win for mental health, and it takes us one step closer to ending the cycle of incarceration in our community. I want to thank everybody for their involvement in the study and the hard work on this issue over the past years, and I especially want to thank Commissioner Jeff Trevelyan for co-authoring this with me. And Commissioner Trevelyan, there you are, if you want to head on up here.
I think it's officially good afternoon. Good afternoon. This is a really important issue for this community. And I think something that demonstrates the importance of this issue is, when's the last time you saw law enforcement, the business community, your elected officials, your community advocates all working in concert to try to address a community problem? Those of us who have worked in the public sector for years, I worked as a manager for almost 30 years in the public sector, and there were many times that I had employees who had insurance and wanted to get treatment, but there was no bed in Travis County to provide for them. We talk about how important diversion is and how effective diversion can be, how cost-effective diversion can be, but if we don't have beds and we don't have professionals to address the needs of our community, then we fall into a crisis state, and that's where we are now. And what we're asking for is that we continue to work together as a community, that we continue to build partnerships, that we talk to the governor's office, who has declared mental health an emergency, but has not directed state dollars to address those emergencies. Yes, it's important that we harden our school perimeters, but it is more important that we address the needs of the children in those schools. So we have to work together and make sure that we build an operation and that we understand the funding systems that are in place at this point. We all know that public education is severely underfunded. We know public health is severely underfunded. We know what's been going on with the kids that are wards of the state, severely underfunded. We have to work together in a community as leaders to determine what our priorities are, and this is a priority for this community. It's important that we address the needs of our community where they exist. It's also important that when we tell our community that addiction is a health matter, that we give them reasonable health alternatives and not just jail. When you look at the Eastern Crescent, a vast majority of people who get any mental health assistance at all get it in jail. That is criminal. It is important that we work together as a community to build the institutions that serve our community, and particularly our children. That's why we're working together, and I hope that we continue to build so that we can heal this community and build a place that we can all be really proud to operate in. Thank you.
Thanks. Sheriff.
Good afternoon. You know, a diversion center provides options other than the emergency room or jail for law enforcement. I support a diversion center, which is one of the recommendations made by the many professionals who contributed many hours of their hard work and expertise as part of the Mental Health Steering Committee. Their full report will be presented and discussed Thursday at Commissioner's Court. A diversion center is important and needed, but it's not the only part of the solution for men and women with mental health needs. To work effectively, it has to function as a place to manage a crisis, and then relatively quickly place people back in our community with housing as well as mental and social support to help them from coming back. We talked about Miami-Dade and how they received recognition of their diversion center efforts. They're currently renovating a building that will become their diversion center. But what's important to note is that they built the physical structure, they're building the physical structure, but they've already implemented many of the solution strategies, and we need to take a note of those strategies. When you look at other counties here in the state of Texas who have built diversion centers like Harris, Bexar, Dallas, Tarrant counties, you'll find that their jail population with a mental health designation is around the same percentage of ours here in Travis County. This demonstrates that Travis County is doing good things. Of course, we can and we should do better. According to the Texas Commission on Jail Standards August 2022 incarceration rate report, Dallas County is at 2.18%, Bear is at 2.14%, Harris 1.94%, and Travis County is at 1.50%. We are incarcerating fewer people per capita than counties with diversion centers. We care about this issue, and it shows. The men and women working in your Travis County Correctional Facility know the people dealing with mental health needs, and they know them by name. I want to end by saying we need to keep our focus on the people we serve and not allow anything to distract us and get in the way of this diversion center and the needs of those with mental health. Individually, we simply cannot make a significant impact on a matter of this magnitude. It will take all of us working together and nothing less. Thank you.
Good afternoon. I'm Delia Garza, County Attorney. Our office prioritizes making sure that we're addressing violent crime and making sure that we are focusing on the public safety of this community. And as I stated in the meeting earlier, in my previous time working in public safety as a firefighter, I had so many more tools available to me to address things that happened, a variety of things, from a cat stuck in a flyover to somebody needing to be extricated from a vehicle to somebody needing help because their house is on fire. So many different crises we were able to meet in that public safety capacity because we had a very large toolbox and a costly toolbox. But we know that we need to invest in those things for our community. And here I have found in this position that toolbox is so incredibly limited. For our law enforcement, for our office, as much as we try to divert low-level nonviolent offenses out of the criminal justice system, we continue to see this revolving door happening, and the only way really is to get to that root cause. And so our jails have really become a repository of failed policies, failed lack of funding, but I understand why. Having worked on very large budgets at the city, I understand these are very costly items, but the return we would get, a safer community, people getting the help that they need, not just sending people to jail because we have nowhere else for them to go, is key. And so I'm so grateful for the Commissioner's Court, for Judge Brown, and Judge, Commissioner, I just promoted you, Commissioner Trevelyan for, their efforts in leading this, but I know all the other commissioners are committed to this. And I do hope as we continue down this path, the focus remains on the people that we are trying to help. That's what this is about. This is about helping the people that elected us to stand here and try to and sit in those meetings and try to solve these issues. It's not about more meetings and more stakeholder groups. It's about focusing on how we help people, and the quicker we can do that, the better we are serving our community. And so I'm grateful for this step and putting us on that path to resources, to increasing our toolbox to address this very necessary resource in our community.
Judge Needles, go ahead.
Thank you. Good afternoon. I am Tamara Needles, Judge of the 427th District Court here in Travis County and also Chair of the Behavioral Health Criminal Justice Advisory Committee. Through my work as a defense attorney before a judge and then while being on the bench, I have seen time and time again the need that we have for diversion and the need that we have for culmination of services for those folks who come through my courtroom with behavioral health issues. And so today I'm ecstatic to see this court and this vote make that progress. It's something that I personally in my courtroom have wanted for so many years. I say that, though, with the cautionary excitement. What I think at this point we need to ask our community to still do is work very much like the Del Med Steering Committee did with our community in finding out what is best for a diversion center for Travis County. We aren't Miami-Dade, we aren't Tucson. We do need to go collect that information, but it has been a huge help to have our community involved in addressing what those needs truly are. And so today, my ask of the community is to continue to use your voices. We have people from all walks of life and across the community on the criminal justice side, on the behavioral health side of the house who have worked on this. And I look forward to seeing that continued work so that the model that we put together for Travis County is something so very unique and so very purposely driven for this community that it serves all of ours and something that we will be very proud to have to help the persons in our community that suffer the most. Thank you. Thank you again, Commissioners.
Thanks,
And
Judge.
Farrell.
You do not? No? You're good? Okay. All right. So I think that's it. If y'all have any questions, happy to take those. Yeah, Haya.
Given that the briefing is on Thursday, why did we wish to vote on it today instead of next week's meeting?
A lot more people watch on Tuesdays, frankly. The report, we all got it a week ago, so we've had time to digest it, and that this was one of the recommendations in it, frankly, goes right along with that. I think that we're going to see when they give us the report on Thursday that there's a whole lot more that we need to do in our community based on what else is in that report, and I look forward to working with folks to do that. I know Commissioner Howard, in particular, is working on what we can do in the interim between today and when it's built. I think the Downtown Austin Alliance referenced the desire for us to do that, and some others of doing a pilot or something that we can do maybe with integral care in the interim at facilities that already exist. Yeah, Fred.
I've noticed the focus is mental health, but I've also heard that Commissioner Trevilian mention addiction.
Yeah.
Are we talking also about helping people who may have behavior affected by drugs?
Yeah, absolutely. I think there's so many co-occurring instances of people who have mental health issues and substance use issues that cycle through the criminal justice system. I think this would be addressing all of that, but Commissioner, you want to?
The goal is to meet people where they are. People find themselves in crisis for a number of circumstances. Those of us who have had family members who we've lost to addiction understand that had the resources been there, had they been able to get into a bed, had they been able to go through detox and counseling and a 12 steps program and the whole continuum. We're looking to address a continuum of issues, and if we handle it piecemeal, I don't think that we will be as successful as we would be if we looked at core issues. And I think that the county attorneys spoke to that we really need to look at core issues and putting the resources across the community. And that's why it's so important for us to sit down, work together, strategically talk through what is available and how it is deployed.
You talked a little bit about how this is just one part of the recommendations that were made. Can you talk a little bit about how the county will start to implement the remaining 4 recommendations in the report?
So the most important thing for me always is to make sure that we are thoroughly going through the materials, we're thoroughly identifying what our priorities are, and then we bring our experts into the room, our executives in the room, and we work through our budget process. We've identified priorities for a period of time. If you remember, one of the first things that I did when I became a commissioner was I asked for a complete evaluation of our justice planning program to identify all the programs that we were working in, what the key performance measures were, what the outcomes were to determine what was effective and what wasn't effective. I think this is a part of that same continuum, to look at what is here and how it should be deployed, and to have our professionals tell us what infrastructure is in place and is currently funded, and what needs to be brought into the picture over the long term. So, I'm a process person. It's important for me to understand the problems that we can solve, the indicators that we are looking for, the results that happen because of investment, because it is an investment.
Commissioner Howard wanted to add on to that, I think.
Thank you, Judge. I think when you look at the report, you'll see there's other things that, like the call to improve our data sharing and just data records around this issue. Also for peer support programs to be expanded in working with this population. And when you look at other diversion centers they include that work. You have to have the different systems of law enforcement, healthcare, housing, workforce, and law enforcement working together to make a successful diversion center and sharing information. We also are relying more and more on the expertise of lived experience and peer support. And so as we pilot these things, as we build them out in the diversion center, we're going to be using that fuller report because it's all that report was tailored to this population at the nexus of behavioral health issues and law enforcement in criminal justice. This is not the answer to all our mental health struggles in Travis County. There's many yet unmet needs. This is laser focused on a population that's really cycling in and out of street, hospital, and jail. And that's expensive to their lives. It's also expensive to our taxpayers. Thank you.
Thanks, Commissioner.
I know there's been a lot of talk about getting people out of jail and getting them back on their feet again, especially with the expunction expo coming up. I'm wondering, will people's arrests stay on their record or also redirected to a diversion center, and what is the process of what afterwards?
Yeah, one model that we all, I think the sheriff and judge and commissioners and I went and looked at was in Nashville, and the way that they do it is you are booked by the police, you go briefly to their central booking facility where you're immediately assessed for your kind of mental health needs. The prosecutor, who in this case would largely be Delia Garza, and the mental health experts, the psychiatrists of the diversion center, kind of decide on the criteria. And then in Nashville, you spend an average of about 14 days in that mental health facility. I think it ranges from 14 to 30 days. And if you complete what the psychiatrist says you need to complete to get stabilized, then your charges are expunged. So that's the way they do it in Nashville. That's something that I would like to see us do here, but I think Delia might want to comment on how that would work.
There's a lot of discussion that needs to happen around this, but we would definitely be open and part of the conversation on how that gets done as quickly as possible. People usually have to be represented by defense counsel for that kind of process. So then we'd, like our expunction fair, we have a bunch of volunteer defense attorneys or just attorneys helping through that process. And so we would have to figure out exactly what that process looks like for this to make sure that they're represented during the process. You usually also have to wait for the statute of limitations for the original offense to run. But we have been, under my administration, we've been waiving that statute of limitations so people can get those arrests expunged sooner. And so it's absolutely an opportunity and a benefit we could bring to this process.
Thank you all for listening. I'll be on the extended process.
Thank you.